ven a ver, sienta a Juanita aquí, mira. Mira, para que le dé a Juanita. Se lo pone aquí en la nariz. Pónselo.
Ponlo.
Pónselo ahí en la nariz. Así, así. Y pónselo. Tú se lo pones, ¿ves? Así. Yeah. Y ella lo hace. Y respira muy bien, Juanita. ¿Ok? Y ahora mami. Póngaselo, mamá. Mira, mira. Yeah.
I grew up going to the community, serving the community with a public health services that my father was running back in the Dominican Republic. But when I came to training to the United States, I also was able to provide services in the community. I initiated very early on in my life the community service, the visiting the homes and learning about the patients throughout my training. However, this community is very unique. And what makes this unique is that now we have higher demand, we have more complexity for the care that they need, and also we have a system that is not ready to receive them in terms of the cultural aspect, linguistically and otherwise.
Al traer a mis hijas acá a la Casa Ruben ha sido algo muy bonito porque cuando ellas vienen acá y vienen y pasan el momento con la doctora, llegan a casa, Julia y Sofía, y llevan bonitos comentarios de la doctora, y eso a mí como padre me llena de emoción y me siento contento.
And I used to not like going to the doctor because most doctors I had in the past, they were like nice, but they weren't very they didn't really care because they had so many other patients. But I don't really know how much this doctor has of patients, but it seems like she does care about us, and she's like super nice.
Como si fuera, esta es la parte de abajo del pulmón, es como las ramitas más pequeñas. Entonces, eso se estrecha así. ¿Por qué? Porque es la parte de la compensación. Es como la niña trata de coger más aire y se estrecha y se queda el aire atrás.
So we are serving them for the first time, opening the access at affordable or at no cost at all to them. So we are also linking them to what we call the social determinants of health, or those aspects of the social services that they need. We have done the work for over 30 years now. However, the funding was not coming from specific places. It was coming basically from small grants and contracts. But at this point, when we go for certain initiatives, they say you are too small to be able to receive the dollars, although you have worked for 30 years. So that is unique and is challenging, and we are adapting to it by just going to very unique foundations like the Shatner Foundation, the HIF, Healthcare Initiative Foundation, that trust startup organizations or organizations that are expanding the services to be able to do the best for the community. But also how they do the mobile clinic. Many people know that mobile clinics, are in the community and they can provide primary care, but our community needs more than just primary care. When we go out with a mobile van, what we face is basically urgent care or emergency care material, meaning that patients come with very challenging conditions that need to be addressed at the moment.
Como pediatra, le aconsejo a los padres que vacunen a sus hijos porque no hay ningún niño que sea...
We are lucky to have vaccinations that are preventable vaccinations, like the influenza, like the COVID-19, like many of the others in childhood. So what we explain to them is this is what the school requires, because those are communicable diseases, and it's important that your child and others are protected. But these are other vaccines that are important for your child.
¿Te gustan las vacunas? Oh, ok, qué bueno.
We continue to provide so many services and that our numbers continue to increase, but also that each child that comes here receives numerous services throughout the year. It's not like we see them one time and say goodbye, never again, but we follow every single condition, every single disease or diagnosis that they have, but also we follow with the referrals. That's what makes this clinic unique, and that's what makes this clinic kind of open to the community because they know that we care.
Mira, mira, para ti.
Everything is meaningless if we don't have compassion for care. And that's what I learned very early on in my own home. But I also learned that equity is essential. That's what I call social justice. I could know a lot as a doctor, I could be at great universities, but if I don't know how to deliver the care and I don't know how to communicate with my patients and be able to be compassionate, that knowledge is worthless.